If you find yourself fatigued, running cold, having trouble losing weight or maintaining your weight without gaining easily, maybe you have constipation, maybe you have dry skin or hair loss, or heavy periods, these are all signs that can be related to a thyroid condition known as Hashimoto's thyroiditis. Now, Hashimoto's thyroiditis is a form of autoimmune disease, and it can be asymptomatic in the beginning, so it's important to know how to get tested. Now, when you get your thyroid screened at a doctor's office, usually they run TSH, or thyroid stimulating hormone, and that's a marker of how well thyroid hormone is getting into the receptor sites in your body. If it's high, that can mean that either your thyroid's not producing enough thyroid hormone or that it's not getting into the receptor sites and having effect. However, you can't diagnose Hashimoto's just from a TSH. You need to also run thyroid antibodies like tissue peroxidase and antithyroglobulin antibody because those can be positive even if your TSH is normal. Now, a lot of times this is silent at first. There's no symptoms. And this is why I think that it's super important that this should be part of routine screening. And there are 3 periods in a woman's life when we should really be paying attention because these are the times it turns on most commonly. And that would be when girls get their first periods, in the 3 months postpartum, and at perimenopause. So Hashimoto's thyroiditis is a common autoimmune condition that affects thyroid function. Just like other autoimmune conditions, in order to put it into remission so that you can be symptom-free, we have to identify what your triggers are for your immune system and then remove them. So the most common triggers that I see in my practice are as follows. Number 1 is gluten and also usually dairy. Now, gluten intolerance is incredibly common. In some people with gluten intolerance, they have a set of genes called HLDQA, and those same genes are related to having a vulnerability to developing Hashimoto's thyroiditis in affected individuals. Now, along with gluten, many cross-reactive foods exist where your body will kind of think the food is gluten, even though it's not, and so sometimes we have to pull those out, at least temporarily as well. Toxins in general are another big trigger. So common toxins like BPA from plastics as well as mercury can trigger Hashimoto's. Viruses are another big trigger. So most commonly viruses like Epstein Barr, herpes virus, and hepatitis C can also trigger the onset of Hashimoto's thyroiditis. Bacterial infections, especially of the gut. So H. pylori is a common bacteria of the stomach, as well as Yersinia Enterocolitica. Those have both been associated with Hashimoto's. And mold or mycotoxins are also a known common trigger for Hashimoto's. So if you're struggling with it, work with your practitioner to get tested for all of these triggers